When I started Citizens for Patient Safety 6 years ago, it was difficult even getting anyone to talk with me. Now, 6 years later, and I would say the last 2 years, I am on the road consistently, almost to a point where I have to be able to learn how to say no, which is very difficult for me because this mission is what my journey is. And so saying no has not yet become part of my vocabulary, but patient safety is coming to the forefront, and consumers are asking questions and wanting to know more. And the medical industry is starting to listen and saying, yep, we have to be on this train too. So it's either get on board or get off the platform, but if you don't, you're going to be left behind. And so it's all going in the right direction. I do approximately 30 to 35 events a year, which can be anywhere from 500 people to as few as 15, just depending on what the need is, and whether it's a consumer group or a health professional group or an association.
Money you should ask. I told him on what's today, Wednesday.
I'm not going to spend a lot of time in the introduction of our keynote speaker, because she will be able to speak for herself. But let me just say, she is a person that you all will be able to relate to for many reasons. But the one reason is she is a consummate advocate. This woman has made legislation happen in Colorado. And, Patty Skolnik is someone who almost single-handedly made things happen in her state at the legislative level. So I want you to listen to her story and engage with her as we proceed with the program. Thank you so much, Patty.
Patient safety is a public health crisis. I think we all know that. And that everyone has to be part of the health delivery system. And in order for the whole total system to work, we all need to be there. The doctors, the nurses, the families, the patients, if able. I remember someone earlier said, well, a patient can't ask if they're too sick. Well, that's right, and that's why everybody needs to have an advocate. Who can be an advocate? You can act as an advocate on your own if you're well enough. You should have questions that you bring with you to the doctor for, just a regular office visit. I want everyone in the audience to be able to identify with the importance of shared decision-making and informed consent, because that affects all of us. We all will be a patient at some time. We all will be taking care of someone we love who is a patient at some time. So I hope that really resonates with the audience. And then the other thing is that if you're going to be with a patient, then you need to know how to advocate for them. And so everyone has someone that they can rely on.
I think this was the best meeting we have ever had, and I thank you from the bottom of my heart for being here and for doing what you do.